everyone, welcome back. Today I wanted to talk to you about UTIs, so urinary tract infections. What are they? How do you know you have one? I get asked this all the time in my office. So I'm going to let you know what I'm thinking of when I'm listening to somebody's story. Okay, so if I have a young girl walking in my room, and usually the story is, doctor, I think I have a urinary tract infection, but I'm not sure what I'm supposed to be looking out for. Help, what do I do? So this is the things that I listen for. To cut to the chase, 3 things, okay? So if you have any of the 2 of the 3 things, I'm pretty much convinced that, well, you probably have a urinary tract infection, okay? First thing, if it hurts when you pee. Second thing, if you're going way more often than you normally go. And third thing, if you actually see blood in the urine, or if when you wipe you see blood on the tissue. Okay, so if you have 2 out of 3 things or 3 out of 3 things, I'm thinking, nah, this is probably a urinary tract infection if you're a girl, and my treatment for you would be to tell you to drink tons of water, unsweetened cranberry juice, and a short course of antibiotics. So that's like about 3 days, okay? And if you're still having symptoms after the 3 days, I would probably just extend the antibiotic for another 3 days, okay? Now, this does not ring true if you only have 1 out of the 3 symptoms. If you only have 1 out of the 3 symptoms, then I'm going to ask you for a little sample, and we're going to test it together in the office. And if you have, white blood cells in that or blood in that you didn't see, just alone by your eye, then I'll be more convinced it's a urinary tract infection, okay? But I'm not going to make the call just based on your story if you only have 1 out of the 3, all right? So that's true for girls. If you're a guy, okay, you walk through my office and you tell me the same thing, probably still going to think it's a urinary tract infection, but then you're in the complicated zone, all right? So they always say girls are complicated, but in this case, guys are complicated. If they have these symptoms, automatically it's complicated. And automatically, probably going to take a sample and give you a consultation to see a urologist, which is a specialist. Okay, girls can be complicated too. If you're pregnant, if you're elderly, or if you have any other symptom or sign, like if you are feverish, or if you really don't feel well, if your back is hurting, then this can be a complicated infection as well, okay? So I lied. Girls and guys can be complicated. And that's basically all I wanted to say, all right? So I hope that was informative. Have a good day. Bye.